Hello, Seán. Thank you very much for coming along today and agreeing to help everybody out with learning a little bit more about the whole testing process. So, many of you will know Seán, but for anyone who doesn't, he wears many caps in Weightlifting Ireland. I think that's fair to say, isn't it, Seán? But the reason we're meeting today is that he is currently Ireland's number one male lifter and has represented Ireland on many stages on many occasions. And I think I'm right in saying you have been tested a good few times, Seán, over the last number of years.
Yes, Lucy. Yes. So I've been tested over 10 times in the last, this is now coming into my 11th year of competitive weightlifting. So I've been in the sport for 12 years. I've competed for 11 of those 12. And I've been tested almost every year that I've competed, either domestically or internationally.
Yeah, great. Okay. And can I ask you if anybody ever sat you down before the first time you were ever tested and explained what was going to happen? Or did you go in really not knowing very much about what the process looked like?
Well, that I have to reflect 10 years ago. So, like 10 years ago, nobody really gave me as much detail as you're offering now, Lucy, on how the testing happened. I kind of was told that you might be tested, you might not. You need to have your passport, and the anti-doping officers will kind of talk you through it. There was no real education as such 10 years ago on the nitty-gritty details of what would happen, how things would go, the paperwork, and all the things we're going to talk about today. So, not really. Didn't really have a crash course. It was just kind of thrown at the deep end, and off you go.
Yeah, super. Okay. So, look, maybe we'll start right into it. And can you tell me a bit more about what happens when you're selected for testing and the tester approaches you at or after your event?
Yeah, so if you can be tested in a number of different locations, you can be tested from home by a whereabouts check, or what's most common is what I've been tested the most at is at competition, domestically or internationally. So what happens is it's basically as soon as you finish your last lift in the competition and you head back to the warm-up area, somebody will approach you. It's the anti-doping officer tester. They'll approach you with a clipboard and they'll look official. They have their badge and they'll introduce themselves to you as the anti-doping officer. They'll say that you've been selected for testing, and they'll meet and greet you. And it's literally right there and then. You've just come off the platform, and they're on you, and they're notifying you of your selection to be tested, and it goes from there.
Okay. So, Seán, what happens? Can you warm down or can you stretch before going in to give a sample? If you do a medal presentation, do you have to miss that? And can you chat to your friends or family at all before you go in?
So medal, you can attend a medal presentation. That's fine. You can do a cool down. You can do the warm down. That's also fine. But chatting to your friends and family and kind of chit chatting and wasting time, that won't really be tolerated. Now, during this whole time, as soon as you're introduced to your chaperone introduce themselves, they'll ask you for your ID. So you need to make sure you have ID present with you at your competitions. Now, in most competitions, both domestically and international, you need to bring some form of identification. For us in Weightlifting Ireland, it's the passport. So they'll ask you for your identification and you'll give that to them. And then they will basically be your shadow for the entire time until you make your way to the designated room or office where you will then kind of produce your sample or start the paperwork and get yourself ready for that. So between going away from the competition venue to the office or the room, they will be your shadow for that whole time. So if you have to do a medal presentation, that's fine. If you want to do a little bit of a cool down, sort out your bag, your gear bag, things like that, that's also fine. But you can't go out to your parents or your boyfriend or girlfriend and have a 40-minute chat about what's for dinner. That kind of won't be tolerated. You need to kind of don't mess around really.
Super. All right. So in you go to the office, and I'm assuming there's a plethora of paperwork that has to be completed, first of all.
Yeah, so once you go to the designated area at the venue, wherever it is, where the anti-doping people are set up, there'll usually be another anti-doping officer there already. So there's usually two, always two. Sometimes there's three. It depends how many athletes are being tested at the event, but more often than not, there's always two. One will be the chaperone that meets you on the competition floor, and the other one will be in the office with the paperwork. So once you get there, then they'll sit you down. There'll be some paper to go through your name, your date of birth, your email, your phone number, your address. They'll ask you for your doctor and your kind of any medical staff or things that you work with. Now, when I was first getting tested, this was information I didn't remember or didn't have at hand. So that would be some advice I give people is to make a note somewhere on your phone or something of who your family doctor is, who is your GP, because that is something that always has to go on the paperwork. And I remember early on in my weightlifting career, I used to have to call my mother and be like, "Ma'am, who's the family doctor? Who is it?" Um, so that's something that is on the that kind of caught me off guard like years ago when I was doing the paperwork. There's also they'll mark a time when you come in. So when you're greeted, the chaperone will mark a time of when they introduce themselves, and that's kind of they have the time from when they meet you to when the whole process is finished, just for their records. There's another piece then on the documentation for supplements
Mm,
and any medications and vitamins and things like that. So it's important that you know what you've taken either in the it's usually in the last week, but I always had a kind of rule of thumb for myself in the last 2 weeks, just to
yeah.
kind of give myself some buffer. So that's anything from Panadol, creatine, protein, vitamin D, zinc, uh, anything of that is
Works.
related.
The
Yeah,
works.
anything
Yeah.
that works, anything that you're going to put in your body that's a vitamin, supplement, medicine, you need to have note or be aware of it. Have a note on your phone or something that if you're tested, you're able to write this down because you're better to declare all these things and the paperwork before the test gets before the sample and all that. Because if you forget something after, then oh, why didn't you declare it? Yeah, it just kind of can get a bit messy.
Yeah, I myself make a little paper note because I'm sort of the pre-phone note thing,
Yeah,
and I pop it in with my passport, so I kind of have the two together.
yeah,
And that's a really good suggestion to have the details of the GP there as well.
mhm,
Yeah,
yeah.
super. Okay, so once the paperwork is done, I'm right in saying you select the container to be used. Tell me a bit about that process.
Yeah, so when you're in the office on the desk, you'll see there'll be a number of boxes. Usually they're cardboard boxes. They can be different, but they're usually boxes, and they have a serial code on them, a unique serial code. And the anti-doping officers will ask you to pick one. Now there's usually five or six to pick from. You can pick whichever one you like. Once you pick it, they'll ask you to open it up, and then in the box you'll have two containers. They'll be marked A and a B. So these are the containers for the sample. If it's a urine sample, this is where you'll put the urine. Now, they sometimes can be glass, they sometimes can be hard plastic. I've seen both styles, but what the anti-doping officer will get you to check is that they are in a plastic sealed bag. Nothing has been tampered with. That all the numbers on the bottles match the box and vice versa. So everything is referenced correctly. So that's once you've picked that, then that is also that number of the box and the containers is also marked on your paperwork. So
Yeah.
everything is traceable.
Yeah, super. Okay, so now for the embarrassing stuff. They have to actually be able to watch you pee into the container, don't they? Yeah. So
Yeah, yeah. So
does that
this
ever get any easier, Sean?
I mean, it's gotten easier now in the last maybe 3 or 4 years for me, but early on when I was tested first, it was a big shock because obviously when you're being tested, the chaperone and the testers will most likely be the same sex as you, so male with male, female with female. You'll never have an anti-doping officer that's the opposite sex come accompanying you to the toilet to observe the taking of the sample. So what happens then is that once you're happy with your sample, your bottles, you take there's another so you're happy with those and you leave them to the side. And then the next thing is you have to pick your sample container. So they have another array of these on the table, and these are just basically plastic beakers. Again, they're always sealed in a plastic bag. You can pick any one you like, and you just have to check that the seal hasn't been broken. That's what you bring into the toilet with you. You don't bring in the A and the B bottles. They stay
Yeah.
in the office. So once you pick your plastic your beaker your container, and you think you're ready to go for a pee, then you make your way to the toilet. Once you're in there, then the anti-doping officer has to physically observe and see the urine leave your body and go into the beaker. So from a male's perspective, we are asked to put our boxers or our jocks down to our knees,
Mhm.
and we have to take our t-shirt up all the way up to our armpits. So when I was starting off, it's actually quite difficult to hold a t-shirt under your armpits and try and pee. So after 3 or 4 years, I ended up just taking my t-shirt off because it just made things simpler for me. I didn't have to worry about trying to
Absolutely.
stop
Yeah.
my t-shirt falling down. And then the anti-doping officer will literally stand beside you. You either, depending on the toilet space in the facility, it'll be into a urinal or into a normal toilet, and they will stand beside you and observe you pee into the beaker. The beaker then has there's a certain volume you need to fill, and the anti-doping officers say just try and fill it as high as you can.
Yeah.
Um,
And what happens if you can't give a urine sample? You're really dehydrated or you can't produce enough urine. What happens then?
so what happens in that situation is if you can't if you don't feel like you need to go to the pee because many times the weightlifting athletes are dehydrated, they've made weight or they've cut it to make weight, and there will be some bottles of water and they will have some water in the office, and they will encourage you to drink a little bit, but not to drink too much,
Yeah.
because they don't want your urine to be too um what's
To
the word I'm looking
dilute.
for, too diluted. There has to be a certain concentration.
There's
So
some
they'll
pH level, isn't there, that
yeah,
they need to have. Yeah.
yeah, there's a pH level on the urine that has to be for it to be acceptable. So they'll encourage you to sip a little bit of water, not to chug liters or anything like that, but you can have a little bit of fluids if you feel like you're really not thirsty. Um, if you happen to give a partial sample, so you don't quite fill the beaker, what they'll do is they'll seal that beaker for you, and you can come back and try again and try and put a little bit more in,
Yeah.
and fill up to that quantity. And the thing is, it can take as long as it takes. So there's no time limit on it.
Mhm.
So that was also something that when I started off, I was kind of worried about and stressing about that. It was taking too long. I was an inconvenience for
Yeah.
them that they had to wait for ages for me to pee or whatever. And after a couple of years and speaking with the anti-doping officers, they uh they reassured me that it's okay.
Mhm.
Like we can take all night if we have to. Um, they're paid to be there, and it doesn't. They've been 6 hours waiting for some people, and that's just how it is. Especially in the boxing, when they told me some stories of when they were doing boxing athletes that can take hours for them to pee.
And you can
So
imagine someone's done a marathon or a 10K or something like that in athletics.
exactly, yeah.
It's very similar. Yeah.
Yeah. So that's the process. If you give a partial, you can try again. And if you don't feel, you just wait. The kind of tip I would give people is that like just just if you think you need to pee, just kind of just wait another 10 or 15 minutes. Because what I used to, again, another another learning experience, I used to think I had to pee and I'd go in and I'd be standing there and nothing had happened. And then in that instance, they'll usually ask you to throw away the beaker and you need to pick a new one.
Mm.
So because we've opened it, we've broken the seal, we've tried to go for a pee, nothing's really happened. You may or may not have contaminated the beaker. They'll ask you, okay, well, let's just go back to the office. You throw away that beaker, and next time you pick another one. So kind of to save all that kind of messing around, just wait maybe 10 minutes more. If you feel the urge, just wait another 10 minutes.
That's great
Um,
advice. Yeah. And this is, this is the value of talking with someone who's been through the process on a number of occasions. It's very real advice.
yeah.
Um, so then we go back in, we have our beaker filled to whatever level, and what happens next?
So once you come back into the office, so at this stage, so you're the only person that's touching the beaker. Okay, that's something I don't think we mentioned earlier, but the as the athlete being tested, you are the only one that touches any of the things. You pick your box, take out the A and the B sample bottles, you touch the beakers, you fill the beaker, so you do everything. The anti-doping officers, they're just observing. Okay, so keep that in mind as well. If an anti-doping officer does like try and maybe seal a bottle or seal a container for you, it's best practice that they don't touch it, just for your own safety. So when you come back into the room, you bring your sample with you. You got your A and your B bottles then. So on your A and your B bottle, there'll be little marks on the bottles where you have to fill them too. So there's a minimum amount you have to fill on each one. So you always start with the A, unscrew the A bottle, get your sample, the beaker, and you fill it in all the way up to the line. Now, off the top of my head, it's, it's 60 or 100 mils. Can't think what's the amount in the A bottle. It's a fair lot. You put most of your sample into the A, and then whatever is left over, you put it into the B. Okay. Once you've filled them both, you have to leave a little bit of your urine, a little bit of your sample in your beaker because they need that for the specific gravity. That's what we talked about with the pH. So they have a little tool there, and it's like a little eyelet, and they put a little few drops onto this, and it tests the specific gravity pH, just to ensure that your urine is not too diluted. Once you get that all clear with that, then they're happy with the urine, and then you start to seal up the bottles.
And that they kind of go round to a kind of a click, don't they?
Yeah, so the bottles are special. They're not just like a normal screw tap. They have these metal teeth in them. So again, if either the bottle is plastic or it's glass, the cap is usually the same. They have these metal teeth, and you screw it and screw it and screw it really tight, and the teeth then start to click and kind of bite into the bottle. So once you've tightened it fully and all the clicks happen, it's you cannot open it again. If you were to, you'd have to break the bottle. So it's this kind of security element they have. So again, you're doing that yourself. So the anti-doping officer is kind of just guiding you, but you close them up, you turn them upside down, make sure they're not leaking, close them both up. Once you've got them both closed up, then there's an accompanying plastic bag for each one. You slip them in the bag, you seal the bag on both sides. So they're in separate bags then, A and a B, and then you return them back into the box they came in, making sure all the numbers are the same. Once you put them in the box, you close the box down, and then you seal the box as well. So the box gets sealed and everything gets referenced. All the numbers are the same. A and B numbers are the same as the box, and everything matches.
It's a very detailed process, and I suppose over the years I've accompanied a number of athletes into the testing process, especially younger athletes who needed someone with them. And I always felt it was like a very professional, thorough, and secure process. But for you as an athlete, how did it feel?
Yeah, I thought I mean, every Sport Ireland anti-doping officer, and even international anti-doping officer I've worked with, they've all been very professional. They've all created a kind of a safe environment to be in. If you make a mistake, it's okay. If you mess something up with the beaker, it's okay. They have loads of different boxes and samples. If you mess something up, they'll help you, and they can just come back. It's okay. We'll just use a different one. And it's initially when I started off, I was a bit nervous going in because like, oh, don't make any mistakes, don't mess anything up. But as I went through the process and year after year, yeah, they're very good at their job. They're very professional, and they make you feel very comfortable in what's happening. And although somebody is like standing there watching you pee, they don't. It's not awkward. They don't make it awkward, and they try and be as discreet as possible. And yeah, I've had nothing but positive experiences. I've had nothing negative ever in the last 10 years.
Excellent. So listen, I know the blood testing's been in for about the last 14 years, and then more recently, the new dry blood spot testing has come in, and you've done both. So could you tell us briefly, because I suppose most of the people who will be looking at this video won't be having that testing, but the certainly the more elite end, I believe, will be. Could you tell us briefly about the, first of all, the regular blood tests, and then more recently that you've had the new dry blood spot testing?
Yes, so the regular blood tests that happened, and I gave urine and blood at that occasion. That was back in 2019, 2018 at a competition in the UK, British International Open, and that was the first time I'd given a blood sample. So what happened with that one is the process was the same. They meet you after the competition, straight after your last lift. They greet you, ID, paperwork, chaperone, just like we talked about earlier. We went to the office, same deal, fill in all your GP, your supplements. All that process is the same as if you're, because I was also doing urine. But the only difference for the blood was that they had to wait a full hour after the competition. Now, this is the old blood testing. This is where they had to put in the needle into my vein as if you're the doctors. So they had to wait a full hour after the competition before they could take the blood, just for the hormone levels in the body and the testosterone level, everything to just kind of subside from the
Settle.
competition.
Yeah.
Now, in that hour that I was waiting to do the bloods, I was able to do the urine sample as normal,
Mm,
because
mm.
I needed to pee, and there was no requirement on one had to be done before the other. So I wasn't really sitting around for an hour wasting time. I managed to do the sample, the urine sample in that time, and then once the hour finished, then we gave the blood. And the process was very similar. Instead of it being a box with two bottles, it was boxes with test tubes,
Mm.
and you picked whatever box you wanted. You checked it was sealed. You took it out of the plastic bag. You checked all the numbers, and then once they used that specific test tube then for the sample to go into. So they took the blood from the vein from a needle, and straight into the test tube, and then you seal it and all that, and everything is referenced. So that process, it was pretty much the same as the urine, but they did more assistance in that regard in relation to the needles and things like that. So they actually had to help and do all that. You weren't expected to stick the needle in your own arm and all this. That wasn't that part of the process. But yeah, it was pretty straightforward. If anyone's ever given blood at the doctors, it's pretty much the same thing.
Same.
But
Yeah.
yeah, same thing.
So
So
what
that
about the
was
dry blood spot testing?
Yeah, so this was new. I have this actually happened last year at me at National Senior Championships, and it was very straightforward. So it was super easy. So they had it's almost like a similar kind of pinprick kind of system that you would do if you're maybe diabetic, or if you ever seen anyone with like like a diabetic kind of a patch that sticks on their arm. It's the same process. So it's a little circular little device, and they basically prick you in the shoulder, hold it in for 5 seconds or so, and there's a couple of small valves underneath it, and the blood just goes into the valves and fills it. It's very quick, very non-invasive. Like it was over before I even knew it.
And is
And
it painful?
no, 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 not at all. It's just like a little pinprick. But she'll the anti-doping officer, the lady I did it, she was like, you might feel a little prick now, and I barely felt anything because they put it into the nice meatier shoulder here is where they did. They don't do it anywhere that's kind of really sensitive, and so yeah, it was very straightforward. I also gave urine as well at that one as well, so I did both. But that was really quick, and there was no obligation to wait an hour for
Yeah.
that either. So that was a lot faster, and it was different than the first time. And again, obviously, it was less invasive because it was just a little pinprick. There was no needles, no need. They didn't have to try find a vein or anything like that. It was just straight into the shoulder, 5, 10 seconds. The blood fills the valves, and they pop it out. So
Fantastic. And I'm sure that's going to be the way they're going to go over the future. Yeah, okay.
yeah.
So listen, the other thing that goes along with this is the precautions that we have to take as competitive athletes. Could you say a little bit about how you have managed things like supplements, over-the-counter medications, and prescribed medications as part of making sure that you stay clean?
Yeah, so I mean, first thing is I suppose it's worth noting is that the athletes, it's your sole responsibility what's in your body. You have to take responsibility for everything you put in your body. And you can't try and claim it wasn't your fault, you didn't know. So that's the first thing. It's full responsibility. What I've done over the years is I've tried to I don't take many supplements at all. I've tried to stay away from supplements
Yeah.
as much as I can. It's good nutrition, good hydration, good sleep to get the basics right to help your performance.
And I think
But
particularly a food first approach,
absolutely, yeah,
we
yeah.
can get what we need through our food mostly.
Absolutely, yeah, most of it, exactly. There's nothing wrong with a good fillet steak. It'll do you good, if you're if you eat steak. But I do take supplements like creatine, fish oils, omega-3s, vitamin D, things that are well researched. But I always make sure that I try go for informed sport products so that are batch tested, just to protect myself. So there are many companies out there that have Inform Sport branding, and they're backed by Inform Sport, which means that certain batches of their supplements, either creatine or protein or whatever, have been tested and they have the stamp. And if you go for those ones, you're giving yourself a better chance of being protected. Nothing is guaranteed, obviously, but it is the best route. It's the best route. Um, Also in relation to supplements and medications, you need to check everything online. So Sport Ireland have MediCheck, which is a very good resource now. It's been updated in the last years. It's really, really good, really user friendly. There's also ones from Globo Joe or Globo Pro, which is for UK and America. So there's different online ones. So you need to check your medication, um, and it's over-the-counter medication. You need to check more than anything else, because there are certain versions of things that are not okay, and some are like anything with cold and flu plus. You need to check it and be wary of it, because the cold and flu versions and the plus versions, they tend to have things that are not permitted, especially in competition.
Exactly.
And
Yeah.
yeah, so you need to check everything on those things. MediCheck is really good. And then in relation to prescription things, you need to really talk to your doctor and tell them that you're competing, you're in a competitive sport that is tested, and get them to realize that that's what you're doing, and you want to be protected in that regard. Get them to see if there's maybe alternatives. If something is on the ban list, get them to obviously check, maybe checking these things with you. And then obviously if you need to go down the route of a TUE, then you contact the anti-doping officer, and you go down that route. So they're the precautions I've taken, but um, it's mostly the only supplements I take religiously is creatine and fish oils. I don't even take protein powder that often, because just I eat well, and I just tend to forget about it, to be honest.
Great. Listen, Sean, that's been a fantastic treasure trove of information, and hopefully will really help all our new lifters and athletes when they get tested for the first time. Thank you so much.
No problem, Lucy. Thank you.